Hey, it's Jessica DaMassa with WTF Health. I'm here at AHIP's Consumer Experience and Digital Health Forum, and joining me right now I have David Innes. He is the CEO of GreatCall. And David, you guys have a dream of a partnership with somebody like BestBuy, and I understand that what you guys are working on is kind of equipping the home specifically for seniors to help them monitor their health. But there's a little bit of a misconception, you said, about this relationship and what's going on. So tell me exactly what the deal is with BestBuy.
Yep. It's funny, when people first hear about it, they think of Best Buy just as a retailer.
Totally.
But Best Buy's strategy, now that after turning around the company in the last 5 years, is really now to expand into services. So, you know, with Geek Squad has become huge, obviously, as a part of that. But now the goal is to really enrich people's lives through technology, in particular seniors and caregivers. So that means not boxes on shelves. That means going into people's homes and maybe making seniors more independent and safe in their homes by using technology to do that.
Okay, so what kinds of things are you giving these seniors? Like, what are you equipping them with? I mean, are we giving them iPads and Fitbits, or what are we doing?
Right. Well, we have some of our own technology, like simplified smartphones, even flip phones that have health and safety services embedded in them, like brain games to improve mental acuity, and things like medication adherence. But also we go in and put sensors into people's homes, particularly working with commercial healthcare partners. We'll go in, we put activity of daily living sensors in to monitor just how things are going with the senior. And then we can take that data back, and we have predictive algorithms that can then highlight when something is going wrong. And we've kind of had some really good success where we've proven, even some published studies where we've shown we can reduce the healthcare cost of that senior by about 20%.
Okay, so back up a little bit for me and unpack. Yes. Okay, so the activities of daily living, which is like a lovely little phrase here, a buzzword phrase, in healthcare. So what does that mean to you guys? Like, what kinds of things are you tracking with these sensors?
Well, so activity of daily living monitoring is about, you know, in and out of bed, in and out of chair, in and out of the house, motion around the house, fridge activity, even bathroom activity. So you can paint a picture of how things are going with that senior. And then if you're working with a healthcare company that has the claims data that you can work together with, you can then close that loop on the predictive algorithms, if you understand what I mean, so that you know, like, okay, this is what was happening with the trends when this health event actually happened. Now you can get that information back and improve the algorithms if it wasn't predicted. And vice versa. If the algorithms predicted something but then nothing ever happened, then maybe you can get more information into the feedback to constantly improve the ability to predict issues before they become exacerbated, expensive health issues.
Okay, what are you predicting? Like, what kinds of okay, so I'm trying to envision this, and I'm thinking of my little sweet Italian grandma who's like 80, and she's pattering around her little house and cooking things and whatever, and she's using the fridge and she's using the bathroom and whatever. What can you predict? Like, what kinds of blip in the tracking are you looking for? And then what kinds of, I guess, healthcare events or crises or whatever are indicative of that little blip?
So onset of depression, right? So
you can tell that by movement.
Onset of depression, you can tell by changes in the amount of time being spent in the bed, or how much time out of the house. Are they actually leaving their room and coming back in? Urinary tract infection obviously can be detected. And again, we just have a flush sensor on the toilet so that you would know, if the frequency going up. Meal suppression, so appetite suppression. So if the fridge isn't being opened, so you have a sensor on the fridge. Now, all of those things, those aren't necessarily disease states, but what happens is we then follow up with the senior when there's something going wrong, and then you can really pull out and find out what's happening before it really does go wrong. And that's why, so it's much better than vitals monitoring, because vitals monitoring requires behavior change versus ADL monitoring, activity of daily living monitoring, requires no behavior change for the senior.
All right, how are they responding to this? Because this, to me, I think about this, and I think, like I said, about my own grandmothers, and I think about, how old they are, and, the things that have happened in their lifetime. These are people who were born in, the 30s or the 40s, and it's they saw the advent of TV And then now we're expecting them to use like a tiny little, a phone, even if it is, senior friendly.
Yes.
I mean, we're expecting them to basically use magic to like track things and do things, and there's sensors around their house. Are we expecting a lot from them? Are they taking okay to this? Is this some like miserable sci-fi film they saw in the 60s and they're terrified of this stuff? Like, how are they doing?
Well, I'd say there's two real issues. The first is privacy.
Yeah.
So you really have to get them comfortable with the fact that this is not information that is going to be used for any other reason other than to keep them safe and to keep them out of the hospital and to keep them independent longer, right?
They believe you?
Yeah, so...
No, I'm just asking because like seniors are like, I think of the ones I know and they're like tough.
Right. So we for example, we have a partnership with Magellan Health right now where we're doing these installations, and we have a 50% opt-in rate, which is really, really high for a program like that. Cool. So yes, they are believing us, and they should believe us. And
I'm not saying they should.
Yeah.
But I mean,
well, and that's where it helps now being part of Best Buy, right? It's a trusted brand name. Sure. You've got Geek Squad. We also have John Walsh as our company spokesperson, who, he has a little video talking about confidentiality and the privacy of the service. And so we have a lot of ways to get them out there. So the first thing is privacy. Yeah. The second thing is onboarding. So when it comes to, so if you're going to ship a smartphone to a senior like we do, so we'll sell them a Jitterbug Smart.
Jitterbug Smart.
That's one of our products. It's the Jitterbug smartphone. And basically, when they get that and they go to activate it, we have a very engaged, invested process for making sure they're comfortable. Right, very robust to get them comfortable, help them get, set up with a Google account, help them get everything together so that they can enjoy that experience.
All right, cool. And so I guess like what kind of outcomes have you seen so far? Like, I mean, both good and bad. Like, I mean, we talk about like this stuff and it's like, this is all new. It's new for all of us, right? Not even just the seniors who are trying to deal with the technology, but all of us are trying to figure out how do you best deploy technology into the home and help people either preserve their health or get healthier or whatever. So how's it going so far?
It's going really, really well. I mean, at GreatCall, we grew the company to about 1 million seniors that we were serving, and family caregivers, by the way. So family caregivers are also a big part of what we're doing.
Sure.
And so that has been really amazing. And then we have had a lot of results on the commercial healthcare side. So working with a managed care company and doing ADL monitoring, we've actually shown we can reduce the healthcare cost of seniors by about 20%.
20?
Yes.
Okay.
So, and that was actually published in the Journal of American Gerontology, one of our studies. So, so the results have been really, really encouraging. If you can engage the senior, get them socially connected, get information back that can be analyzed, that you can kind of predict issues before they happen, get them the help they need, keep them out of the hospital, keep them in their homes independent.
That 20% reduction of cost, what kinds of costs were those? Is it like basically like you've been able to stop more expensive events from happening, or like what was the difference?
So it was pilot versus control, and basically what we showed is that there was a reduction in hospitalizations, there was a reduction in long-term care expenses was a big one, right? Okay. So somebody had an issue, they end up in the hospital, and then they end up in long-term care, and that becomes very, very expensive. Yeah. So if you can reduce those, and then what we did see though is we did have an increase in medications because we're changing medications because we're identifying something before it goes wrong, so there's a lot more medication changing, and in-home visits. So you're also having an increase in in-home visits. So, hey, something's wrong, you know what, I'm gonna send out a caregiver who's gonna come and check on you and see what's happening. So, but that small increase in those categories was way offset by the decrease in hospitalizations and long-term.
So was it kind of like you were taking what would have been done in a long-term care and basically moving it back into the home, which was a little bit less?
No, we're avoiding.
You're avoiding it.
We're avoiding.
Okay, so it wasn't even a swap out. It was
right.
Like avoiding
well,
it.
if you think of it, if it's a urinary tract infection that we can catch before it becomes serious, then it just never happens. Okay. Because then you can get them the medications they need. Yeah.
Got it. All right. Have there been any hiccups along the way here? I mean, like with any new technology, I mean, and deployment at this kind of scale, you know, it's like, especially for big organizations like healthcare, or health plans or health systems or whatever, and then piloting with like a health tech startup, and like you guys are working with Best Buy. I mean, so any hiccups that happened?
Yeah, there's been a lot of hiccups along the way.
Well, yeah, I mean,
it's not all easy.
It's always messy.
Yeah.
Well, can you give us an example of something that happened and how you guys worked through it?
Yeah, one example is that when we were working with commercial healthcare programs at the start, so managed care programs, you know, they have care managers that have a panel of seniors they're looking after, each care manager. And we were flowing kind of the data directly to them at the beginning, where they were kind of getting a little overwhelmed with all the information that they were getting, saying like, oh, this person has had too much of this, or this person has too much of this. And
the case managers are like, oh,
they're already busy and they're already stressed out. And so instead of making it better, we were making it worse. But so what we did is we implemented our own group that sits in between and does some of that initial triaging and calling to the senior to dig a little deeper into the issue, so that when we do notify the case manager, we're giving them very specific, real information about those people that truly need help right away.
That's really smart. I mean, in long term, that actually probably, shifting in that way with your design probably will reduce, long-term extrapolated expense, right? Because it's like people are not just being flagged and put in through their case manager and into a more expensive point of, I guess, like triage than what you guys are able to provide. Well,
when you think about these case managers, they have a panel of, it could be, between 100 and 200 seniors they're supposed to be monitoring. And they don't really have any information on they can't call and contact each one every day. Yeah. And so they don't have any information to really, truly prioritize who they should be working with every day. And so now we're giving them that, so they can be like, these are the 10 people I have to get in touch with today.
Right. So last question for you. I'm curious, this is like one of those topics around seniors and their health and their longevity, really, about loneliness. And that's one of those things where it's like, how do you do that with technology? And so, as you guys are going out, I mean, what I like about how you've explained your relationship with Best Buy and what you guys are doing, it's like there's a lot of hand-holding and there is a lot of human interaction all along the way here. I mean, it's not like you've just thrown those sensors in there and it's like, see you guys later. I mean, it sounds like it's very supported by people. So, I mean, tell me, I guess, have you had any luck with seniors and like loneliness and I guess helping keep them engaged, or are you tracking anything like that with what you've got in their homes? Are you addressing that at all?
Yeah, it's an area that we have to address, that the whole industry has to address. It's social isolation, but we, obviously with our communication products, that's a big part of why we do that, is help them get set up, help them start communicating so that now they are connected to their family and friends, they can share photos, they can have access to other information, and then so we have a caregiver app that the family caregiver downloads so that they're getting information about how mom and dad are doing, so that kind of promotes the communication back and forth between the caregiver as well. Okay. So it's all about trying to keep them engaged, and even just a high level of customer service is absolutely required, right? Like, you need to be able to answer the phone quickly. You need to be able to speak to the senior in a way that's, calm, professional, courteous, compassionate, and that's what we train our people to do through like age sensitivity training.
Oh, very cool. David, it's so good to talk to you. This is such an exciting partnership, and it's really cool. I like that you're piloting this with the senior population, because I mean, we talk to a lot of people who are trying to bring this kind of tech and roll it out to the healthcare consumer in general. And I think focusing on this population, even though they may not be the most tech savvy, there's so much to learn from it. So thank you so much.
Thank you for having me.
Thank you. I'm Jessica DaMassa with WTF Health here at AHIP's Consumer Experience and Digital Health Forum. Thanks for joining us.